Joe Rogan is facing pressure over his interviews on COVID. Some are accusing him of spreading misinformation, but the real damage may be coming from public health officials. Welcome to America Uncovered. I'm Chris Chappell. COVID misinformation. It's a big problem. I'm not talking about people like Joe Rogan who spout misinformation about COVID. I'm talking about people labeling Joe Rogan's conversations as misinformation. That's right. There's so much misinformation that even misinformation is getting its own misinformation. By now you've probably heard that artists Neil Young, Joni Mitchell, and a few others have asked Spotify to remove their content from its platform. Neil Young said he did it because Joe Rogan's podcast, which Spotify has the rights to, has a concerning history of broadcasting misinformation, particularly regarding the COVID-19 pandemic. Young specifically mentioned Joe Rogan's interview with Dr. Robert Malone, which he called highly controversial. I'll talk more about that interview in a bit. After Neil Young asked Spotify to remove his music, they did. They also removed most of Joni Mitchell's. It's not clear why Spotify hadn't removed all her music, at least as of when we recorded this. Maybe they needed background music for sewing a sweater for their cat. But in a way, the boycotters won. One reason Neil Young boycotted Spotify was because the platform didn't have a misinformation policy. Spotify said it did have platform rules, but that they weren't public. After the whole boycotting thing, Spotify made them public. It's probably never a good idea to have rules be private. That'd be like playing a pickup basketball game at a new gym, and when you're about to make a free throw, the other team clubs you with a hockey stick. This is part of the rules, they just aren't public. Spotify also said it would be adding a content advisory to any podcast that talks about COVID-19. A content advisory on any show that talks about COVID? Gee, I wonder what that's like. Joe Rogan had no problem with that.
Sure, have that on there. I'm very happy with that.
Now, Rogan has had experts on all sides of the debate on vaccines and lockdown policies and other COVID controversies. But he's only getting pushback about some of his guests. Those are the guests who don't toe the official line. Guests like Dr. Robert Malone. Malone played a key part in the invention of mRNA vaccine technology and has been doing clinical trials on vaccines for years. In his interview on Joe Rogan's podcast, Malone questioned how well the vaccines were tested and the FDA's oversight of those tests. Because of those concerns, the media has labeled him a vaccine skeptic who is spreading misinformation. Oh, and did I mention he's been vaccinated? Yeah. And he's not against the COVID vaccines. He just thinks people should have all the info about them. Kind of like how I think people should have all the info about non-public rules before joining a pickup basketball game. After the Spotify boycotts, Rogan says he plans to balance out his interviews with more mainstream experts.
If there's anything that I've done that I could do better is have more experts with differing opinions right after I have the controversial ones.
That's fine. If there's one thing Joe Rogan does well, it's asking questions a lot of people have. It might even boost confidence in public health officials if someone like Joe Rogan can ask them questions and get answers people can actually understand. Although now the outrage has already moved on from whether Joe Rogan promotes COVID misinformation to whether Joe Rogan is racist and also sexist. Which definitely makes it seem like the original issue here was about public health and not an attempt to take down a guy who gets a bigger audience on one podcast than CNN does in a week. But when it comes to public health, Joe Rogan isn't the problem. The problem is the mainstream experts. I'll explain why after the break. Welcome back. Yeah, actually, who am I kidding? YouTube would never allow ads on a video like this, which is why we rely on support from viewers like you who support us on the crowdfunding website Patreon. If you like the show and don't like YouTube censorship, head over to patreon.com/AmericaUncovered. So COVID-19 has been a public health crisis, but it's also created a public trust crisis, specifically a trust crisis in public health officials. Polls show that Americans have less trust in them and public health institutions than they used to. For example, a year and a half ago, 77% said they trusted the Centers for Disease Control on COVID. In this January NBC poll, only 44% of Americans said they trusted the CDC. And this poll, taken at my Uncle Steve's cookout yesterday, says 0% of Americans trust those Bill Gates-funded Illuminati space lizards. Look, every family has an Uncle Steve. So what's driving the decline in Americans' trust? It's hard to say for sure, but some of the data suggest it's the CDC's own messaging. This Ipsos poll found that trust in the CDC went down by 6 percentage points after it changed its quarantine guidelines. The new guidelines shortened the recommended quarantine time for COVID from 10 days to 5 days. Now, the CDC is always trying to convince people that it's making decisions based on the best science and data available. And sure, we know a lot more than we did 2 years ago about the coronavirus, and our behaviors should change with updated data. Remember when people thought we should be wearing gloves and spraying down our groceries? But the CDC's sudden quarantine cut seemed a little shady for a different reason. The CDC said the change is motivated by science, demonstrating that the majority of SARS-CoV-2 transmission occurs early in the course of illness. But the timing of that guidance change was fishy, to say the least.
With COVID cases soaring, more than 2,000 flights were grounded worldwide and nearly 3,000 delayed in the U.S. just today. That's on top of thousands over the weekend. And flight crews keep calling in sick.
The airline industry lobbied the CDC to change the guidelines because too many employees were out sick for too long. The airline industry wanted the quarantine time cut from 10 days to 5 days for people who were vaccinated. And what do you know, the CDC changed its guidelines to just that. Does the CDC know you don't have to do what airlines tell you when you're not in planes? Is every chair at CDC headquarters in an upright, locked position with tray tables up? I tell them they can relax, but it's hard to reach them since their phones are always on airplane mode. Flight attendants weren't happy about this change. The new guidelines raised concerns among health experts, not only because the new quarantine time seemed too short, but also because it recommended, but didn't require, taking a COVID test before coming out of quarantine. The president of the American Medical Association accused the agency of not requiring tests because there was a shortage of them at the time. If that's true, that's like a guy saying he doesn't have to use a condom because there was a shortage of them at the gas station. The CDC didn't say whether it was considering the lack of tests, but it wouldn't be the first time a public health agency changed its guidance based on supplies. I'll talk more about that in a bit. What the director of the CDC did say was that they don't require testing to come out of quarantine because PCR tests can stay positive for up to 12 weeks after a COVID infection. Hold on. What? Almost 2 years into the COVID pandemic, and you're only telling people this now? The CDC got a lot of bad press for its new quarantine guidance.
The CDC is under fire for messaging confusion, and most recently, a change to recommendations that people infected with the virus isolate for 5 days instead of 10 without a testing requirement.
That antigen test was actually not authorized for this purpose, and its information would not be useful.
People are getting concerned about why not test people at that time. I myself feel that that's a reasonable thing to do.
If you were confused by the updated guidance, you're not alone. As for vaccine boosters, the CDC director has been all over the place on that.
The window for boosters?
For up to 6, 8, perhaps longer.
6 months, 5 months.
Are they recommending booster timelines or bidding on the Price is Right? Earlier in the pandemic, the CDC was also caught exaggerating how likely it was to catch COVID outdoors. They claimed it was less than 10%, when the real number was probably below 0.1%. It was so bad that one of the authors of the study the CDC cited came out to say the CDC was wrong. No wonder people are confused. Confusing guidance is one thing, but then there's outright deception from top public health officials. Dr. Anthony Fauci has been leading the government's COVID response. Here he is back in March of 2020.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is.
He later admitted he said that because we have a serious problem with the lack of PPE and masks for the health providers. That was a July 2020 cover story he did with InStyle magazine. First of all, what is this photo? Can we stop making public officials into celebrities? Did we learn nothing from the Robert Mueller prayer candles? What's that, Shelley? Okay, we've learned nothing. Anyway, if Dr. Fauci's justification for telling people not to wear masks was that he wanted to save the masks for healthcare workers, why didn't he just tell people to use cloth masks? Fauci said he only started recommending masks when it became clear people who didn't have symptoms could transmit the virus. Except that there was evidence from the very beginning of the outbreak that people could be asymptomatic carriers. That was a big reason people were told to quarantine for 14 days. The point is, it's hard to trust someone when they're basically saying, sure, I lied about that mask thing before, but I'm telling the truth now. This is like your parents telling you you're going to Disney World, then taking you to the dentist, and then asking your therapist why you have trust issues. I don't know, Dad. It's a mystery. So was Fauci justified in saying in March 2020 that masks weren't important? Did the scientific evidence change dramatically? Slate magazine did a review of the data and said, although some have claimed that the evidence changed substantively in the early weeks of March, our assessment of the literature does not concur. There was a lot of stuff we didn't know back in the early days of the pandemic. And like I said earlier, yes, there should be leeway for people who were working with incomplete information. But once you tell people you were lying before, they're going to have a really hard time believing you now. I'll have more on that after this final commercial break. Welcome back. Top U.S. infectious disease expert Dr. Anthony Fauci admitted to the New York Times that he deliberately moved the goalposts on herd immunity. Herd immunity is the percentage of people who have to be immune to the virus before society can go back to normal. Fauci said, when polls said only about half of all Americans would take a vaccine, I was saying herd immunity would take 70 to 75%. Then, when newer surveys said 60% or more would take it, I thought, I can nudge this up a bit. So I went to 80, 85. And he wonders why people don't trust him. This is like a husband saying, baby, why don't you believe me? I was honest about cheating in the past. Some may consider those noble lies justified because they change people's behavior for the better. But many don't. And that could be one of the reasons people don't trust public health officials as much. And here's the other thing. Fauci wants you to think that all his recommendations are based on hard scientific data, not polling.
Because all of the things that I have spoken about consistently from the very beginning have been fundamentally based on science. Sometimes those things were inconvenient truths for people, and there was pushback against me. So if you are trying to, get at me as a public health official and a scientist, you're really attacking not only Dr. Anthony Fauci, you're attacking science.
Right. If you attack Fauci, you are attacking science. Well, in that case, science destroyed its credibility by lying early on. And if science really cared about public health, then science should have stepped down and let someone who didn't ruin its trust with Americans replace them. Also, science looks like a Keebler elf. We did a whole episode on how Dr. Science is shutting down debate on the science. I'll include a link to it in the description below. It also doesn't help Fauci's credibility that he held up New York as a model for fighting the coronavirus. That's like saying that FDR was a model for fighting polio. In case you don't remember, New York Governor Andrew Cuomo ordered COVID patients to be put into nursing homes. And then he tried to cover up the true nursing home death rate. According to the Kaiser Family Foundation, New York is still in the top 10 states with the highest death rate from COVID. And Fauci says New York is the model for how to deal with COVID. Florida did a better job, and their policy on COVID was, la la la, I can't see you. Okay, that's unfair to Florida. They did encourage vaccination and also provided monoclonal antibody treatment, which is way better than sending sick people to infect others in nursing homes. And here's another mind-numbing stat for you. 2 years into the pandemic, Fauci says we're still overcounting COVID hospitalizations for children. He says what looks like a spike in child COVID hospitalizations is actually just a spike in cases. For example, if little Johnny breaks his arm, goes to the hospital, he gets tested for COVID. If he has COVID, even if that's not the reason he's there, he gets counted as a child that was hospitalized for COVID. Is COVID breaking people's arms now? And speaking of data, it doesn't exactly inspire confidence that the FDA has been slow-walking data on the Pfizer vaccine. This medical group wanted to look at the studies that Pfizer used to decide if its vaccines were safe. Both sides agree the group is entitled to the approximately 450,000 documents, but the FDA had pushed for a production schedule that, if approved, would have taken some 75 years to complete. Who's working on that? Sloth? In the end, the medical group got that number cut down to just 8 months. The FDA also took down a document from its website about why it approved the Moderna vaccine. It put it back up after public outcry. Overall, public health officials' treatment of the public during the pandemic has been terrible. It's so bad that even left-leaning media that usually defend the government's COVID policies have called it the worst part of the pandemic response, calling out a pattern of public health authorities adopting a patronizing attitude toward the public they are supposed to serve. So if patronizing people doesn't work, what should public health officials do? The National Academies of Science, Engineering, and Medicine published an article suggesting radical transparency. Messaging needs to be relatable, plain, and honest. The public health sector must increasingly shift toward the practice of radical transparency by telling people what is known, what is not known, and why. So basically, if public health officials want us to trust them in their guidance, they need to start trusting that we, the public, can handle the truth. And the whole truth, not just the version they package for us. Until they do, the public will have more trust in a guy who made a living encouraging people to eat bull testicles. What do you think of public health agencies? Do you still trust them? Let me know in the comments below. And remember, this show is supported mainly by viewers like you. Head on over to patreon.com/AmericaUncovered and contribute $1 or more to help keep the show going. Once again, I'm Chris Chappell. Thanks for watching America Uncovered.